All right, let's see if that's working at all. Ugh. Every time I get on, it's like you look a little bit older, a little bit grayer, a little bit more wrinkly. That's how it goes, right? And med school doesn't make it any better. So jumping on live to talk with you guys a little bit. I got some comments on my TikTok um, asking me to answer some questions about how med school is going. So I figured I'd jump on here. I did have a fresh haircut the last time I jumped on, but I guess I need another one now. So update for you guys. I'm in third semester at St. James. You guys probably you saw it on the thumbnail, I guess. So I'll talk a little bit about that, about making Dean's List for the second time. So that was pretty cool. So that's at our school, it's the top 3 people in the class. And basically it's whoever has the most A's. And obviously you can't have any C's or anything like that. So the courses are pretty tough. The way the curriculum is set up right now is the final exam is an NBME shelf exam. So that's basically comparable to the STEP exams, and it's worth 40% of your grade. So, basically being a good test taker and having requisite knowledge, those two things combined is what makes you do really well in these programs. The basic sciences are designed to get you ready for STEP, because that's the hard thing for IMGs in particular, is passing STEP. And so most of these schools, particularly Caribbean schools, they're setting up their curriculum to try to get you ready to pass STEP. They all have comp exams that you're going to have to pass. And so basically you're going to have to be a very good test taker to be able to get through this program. Whether it's for the right or for the wrong as far as being a physician, it probably isn't. It probably doesn't have a ton to do with being a good doctor, but the only way that they can sort of compare people is through standardized testing. So, being a good standardized test taker it's a big advantage when you're in these programs. And that's, one of the disadvantages people don't talk about Caribbean graduates is typically the Caribbean students, by and large, most of the time they're not great MCAT takers. That's why they end up going to these programs. Now, you can learn to be a better test taker, obviously. I think a lot of the third-party programs out there like AMBOSS and UWorld and things like that, they definitely help with those kind of things, and they help you to be a better test taker. And hopefully by the time you get through your 5 semesters, your test taking skills for multiple choice questions have improved a ton. Luckily for me, I've always been a pretty good test taker. So between that and having a background in healthcare, I think it definitely set me up for an advantage with St. James. So somebody had asked me to compare the chiropractic curriculum versus med school curriculum. And really the 2 big things that I can point at right now that are different is the rate at which the knowledge comes at you in med school is just, so far it's been a lot faster than chiropractic school. And I think I talked about this in a previous video. Biochemistry is just one class. In chiropractic school, we had 2 semesters of biochemistry. So, they're really kind of holding your hand and going a little slower through that kind of stuff. Same thing with physiology. Physiology was one class in med school. In chiropractic school, we had 3 classes. We had physiology 1, physiology 2, physiology 3. We had an entire semester just on cardiac physiology. So the rate you'll see these numbers pop up. What's going on up there, guys? Got a couple people on. Brady Stone and Shay Henderson, how you guys doing? In med school versus chiropractic school, the pace is just a lot different, I think. The material is the same, right? There's not a difference in the material. Let's see what we got here. Yeah, we'll get to that. Questions about chiropractic and their efficacy. So med school is just coming at you a lot faster, and that makes sense because I think I had 8 trimesters, worth of in-person classes in chiropractic school. So that's almost 3 years worth. But in med school, you only have 2 years. So they have to smash all that material into 2 years. So it's just coming at you a lot faster and a lot more intense than it did in chiropractic school. The other difference between the two is that med school questions are tertiary level. And when I say tertiary level, what I mean is that say in chiropractic school, they'd be like, what nerve innervates the deltoid? Give you 4 or 5 different options, right? Or in a med school vignette, you're gonna have to know what nerve innervates the muscle. Then you're gonna have to know where it comes from, and then you're gonna have to know maybe a disease associated with it. So the questions in med school are just a lot more complicated. So it requires a mastery of the information, and an ability to read a question better than in chiropractic school, I think. So I've had a couple classes in med school where like a couple quizzes maybe that were more similar to the chiropractic school where everything was sort of straightforward, where it's like, particularly like histology or pathology, well, they'll show you a slide and they'll be like, okay, what's this? And it's an apoptotic cell, excuse me. Um, but you don't get a lot of questions like that. Like you'll get a physiology question. It'll give you this vignette with the disease, and then it'll give you like 4 boxes of arrows, and you have to like go up, down, up, down, up, down, and you only have a minute and 30 seconds to answer that question. So, yeah, they're pretty tough. Like I said, I know the material pretty well, and my raw scores on the NVME exams are, they're good compared to the national average of med school students, obviously. Like I think I got an 87% raw score on my neuroscience shelf, an 83% raw on my biochemistry shelf, and a 75, I think, on my physiology shelf. But the national average was 61 on that exam, so I was still 14 points above the national average. But yeah, the exams are tough, and that's with me having taken these classes previously already, right? Like this is my 3rd time taking microbiology. I took it in undergrad, got an A. Took it in chiro school, got an A. Should get an A in med school as well. Same thing with biochemistry. I got an A in undergrad, got an A in chiro school, got an A in med school. So definitely I'm at an advantage compared to some of the other students when it comes to that stuff. But yeah, the 2 biggest differences, like I said, in the curriculum is the speed at which the information is coming at you, and like I said, the tertiary level of the questions. Brady Stone, what's up, man? Okay, yeah, somebody said, so what was the question about chiropractic efficacy? So I guess the first thing I would get to with that is that chiropractic is a profession, not a treatment. So spinal manipulation is what people talk about. That's the thing most commonly associated with chiropractic, but it's not unique to chiropractic. It's taught in all doctor of physical therapy programs. It's taught in all doctor of osteopathy programs. They call it a grade 5 MOB in PT school, and in osteopathic school, they'll call it an HVLA. It's a good that are non-surgical and that, very specific joints. So what that does, it creates motion, but that in itself isn't going to change things usually. Usually you have to do strength training or other things like that to maintain the motion that you gain from the manipulation. Chiropractic is a field, the scopes of practice actually vary a lot in different states. All right, so Judd says, in my opinion, I feel like chiropractors focus more on aligning bones and discs that are misaligned. However, in my studies, I've seen it's usually the paraspinal muscles that pull or cause issues. Yeah, I don't disagree with that at all. And if you want to be very specific, joints and discs don't align or move out of alignment at all. That's not a thing that physiologically happens. That's terminology that's useful for the public because, like they'll come in and say, oh, I have a slip disc. So I could spend all my time arguing with them about the pathophysiology, about how discs can't slide relative to the bones. But that's not very useful. That's not what they're here for me to argue with them about physiology. If that's the terms of which they bring to you, then you just sort of communicate in that fashion. But yeah, by and large, for the vast majority of people, your joints don't move out of place. Particularly in the spine, you've got ligaments all around the ALL, PLL, you've got all these ligaments. Bones don't just slide around or move out of place. When they do, you get things called dislocations, like when your shoulder gets dislocated, and even certain tendons, like your bicep tendon, can dislocate. And then there are outliers. There are people with like connective tissue disorders that they actually do have a lot of movement. But for 95% of people, their bones don't actually move out of alignment. That's just sort of like it's just the way that people communicate colloquially. It's not scientifically. But I agree with you. I think that most pain is caused by, especially for like middle-aged people and things like that. It's more due to the fact that they've got chronic restriction or poor mobility in the muscles, or their muscles have become atrophied. They've got fatty infiltration in them, or they're underutilized. Like we sit all day, so like your abs might be tighter and your hip flexors might be tighter compared to your glutes and your erectors, and so they're weaker. And so because they're weaker, what happens? Your body senses instability and it spasms the muscles. And when they spasm, your body will lay down extra connective tissue according to Davis's law. So the connective tissue in your back will get thicker over time. And really the only way to change that is to get in there and loosen up that tissue, to break up that tissue. And then after you've done that, to retrain the muscles. So where manipulation works the best is like SI joint dysfunction is a good one. Like when you have a really sharp acute pain, like right on your SI joint, usually that's a fixation on one side versus the other. Sometimes facet joints, if the pain is like 1 inch to the right of the center of the spine, it's very focal and pinpoint. Manipulation can help that. There are intervertebral fixations that can happen. And the other big one is rib fixations. Like people will say, oh, I've got a rib out, which the rib isn't really out. If you look at the anatomy, the ribs can't go out. The back of the facet joint of where it attaches, if you did that, you would fracture bones. But again, that's just the terminology that lay people use. They'll say, I have a rib out, I've got a rib out. So people will always come in with that terminology. So we just kind of meet them where they are. But by mobilizing that joint, and the way they'll notice that is they'll take a deep breath and have a very sharp pinpoint pain right where the rib intersects with the thoracic vertebrae. And then the connective tissue over the top of the muscle over the top of that will be spasmed as well. And you can actually feel it stick out. And what you're probably feeling there is not actually the bone sticking out. You will feel a lack of movement in the bone, but what you're feeling is a bunching up of the muscle there. So when you move that joint, you get the movement going in there, the pain is less, and so the muscle relaxes. Now all of a sudden that bump that you feel sticking up has relaxed. But that's what patients believe is happening, and even a lot of providers will start to believe that over time as well too. And we also have to realize that like there's a lot of things we can't study. Like pain is very difficult to study in RCTs. It's a very subjective experience. But I will tell you that chiropractors that make claims about like treating visceral disease is it's just anti-scientific, to be honest. Like you can't, you can't treat high blood pressure. You can't treat, systemic disease with manipulation. There are things that you can do to help them, physiologically, mentally, relaxation techniques, biopsychosocial communication, teaching them to deal with their pain a little bit better, and improving sleep quality is important. Stuff like that's important. Jide says, please correct me if I'm wrong. Does the motion cause endorphins, which cause the euphoria, or what is that makes people feel good after that motion? There are some studies that believe that to be the case. I don't know that it's ever been measured in serum to know that exactly that's what's going on, but most people do get a dopamine high if you want to get technical with it from manipulation. That's why people crack their necks all the time. What we think happens is there's nitrogen gas that's dissolved within the actual joint itself. And what might happen is that it creates little bubbles when you deform the joint, and those bubbles pop. And that popping is probably what we're hearing, we think. It varies by joint, obviously, because a lot of our joints are different throughout the body. And it could be that the gas actually running into the joint capsule itself that has mechanoreceptors, it might have a reciprocal inhibitory effect, so meaning it turns the muscles off around it. And by relaxing the muscles, that provides pain relief. We know that generally speaking, motion feels better. Like stiffness is a perception that we tend to have of pain. Like if you're sitting on a plane for a long time, if you've ever been in a cast and you try to straighten your arm after you've been in it, it hurts a lot. The joint is stiff. It takes a little while for that tissue to warm up and to kind of stretch out a little bit. So those are kind of some of the things that go on with that. And how's med school going? Like I said, it's good until it's not. That's always how everything is, right? So, so far, I think right now I'm number one in my class. I've pretty much crushed every class I've had so far. Again, I'm a second year now, so I'm an MS2. So I should be taking STEP at the end of this year. It's a lot, it's busy. It's very busy. My school's mandatory attendance, so you have to be in class from 8 to 5. So that's a lot. And particularly if your professor doesn't teach in a way that's beneficial to you, which isn't always the case. I've been lucky so far. Most of my professors I can listen to and absorb, but I know a lot of people don't learn that way. So, if they're forced to be in class for 8 hours versus them using a third-party resource that's better for them, that just adds more time for them to have to study onto that. I've been able to develop a system over the years that is sort of an in between generations, I guess. Like I treat the school as a job, so I really try to focus while I'm in class to get as much as I can out of it. And then for the exams, I mostly will use the professor's slides. And what I'll go through is I'll look at a slide and I'll make 3 or 4 Anki cards myself out of it. And I'll use speech to text. So I'll look at a slide and I'll look at it and I'll be like, okay, what are the questions that a professor could ask me out of that, right? Like, so if I see a bunch of interleukins, I'll say, what's the interleukin that's most responsible for fever? And then my answer will be IL-1. And I'll say, okay, what's the interleukin that's most responsible for acute phase proteins from the liver? And it'll be IL-6. Or it'll be like, what's the icosanoid that's most important for vasodilation and inhibits platelet aggregation, right? And it would be PGI2. And I have to differentiate that from PGD2 or other things like that. So I'll make flashcards of them. And the process of making that flashcards for a test or a quiz usually take 4 or 5 hours, I think. And then I'll try to get through that. If I get through that, it'll make 400 or 500 cards out of that. And if I get through that maybe 3 or 4 times, then I'm pretty sure I'll get an A on the exam. If I only get through it twice, I may be high Bs. And if I only have a chance to get through it once, like say you have 5 exams in 4 days or something like that, so you only have 1 day to go over your cards. Now we're looking at, low B raw scores. So at our school, they do curve the final exam a little bit, for better or for worse, like I said, Caribbean students tend to not score quite as well on standardized exams. So the class average is usually below the national med school average, which is not a surprise, right? Like US med schools have the best of the best students. These are kids that all have 4.0s, by and large, and 515 plus MCAT scores. So they've demonstrated that they're going to be good test takers. And a lot of times, some of the more rural DO schools and the Caribbean schools, they have folks that are just not as good of test takers. That doesn't mean they're not as smart. They just don't specialize, quite as well in those kind of exams. And unfortunately, because some of these schools do curve the exams, I think it lulls some of these students into a false sense of security that they'll be able to pick it up when they get to MD5. And so they could be scoring 15, 20 points below passing, and still passing the class. And the thing is, if you're accumulating a 15-point deficit every single class, that accumulates over time. And you're not going to be able to learn all that and review everything else at the last second in MD5. So they end up having to, take the in-house comp exam multiple times, which can really delay their move into clinicals. So, knock on wood, hopefully I'll pass it on the first time. I've cleared all my NBMEs by at least 10 to 15 points. So I am on track at this point to do it, but you never know. You can have a bad day. It could be a hard exam. It could be an exam that's more specialized in something you're not the strongest at. You just never know what that exam is going to look like. But like I said, so far, I've been impressed. He asked, am I at Ross? No, I'm at St. James School of Medicine in St. Vincent. So ACCM accredited, cheapest tuition in the Caribbean. And all my professors have been pretty good. Like my neuroscience professor last semester, she was top notch. PhD in neuroscience. She actually had to flee Caracas, but she was at the top medical school there in Venezuela until political strife had gone through. But all of our professors have been really top notch for the most part. A lot of them are from India. A lot of them are from Ukraine. So, they're taking advantage of a lot of talent that's fleeing other areas that are very, very knowledgeable in their subject areas. So after that, so you take, at our school, you do 5 semesters. You take the comp, you have to score a 65, I believe, of raw score on the comp. And after that, they certify you to take STEP, then you take STEP. So after you're scoring that well on comp, you should pass STEP. It puts you like a 99% chance of passing STEP 1. And then after that, then you go into clinicals, and our main clinical sites are in Chicago, South Texas, and West Virginia, and then you can do electives at other locations. So luckily, having been in healthcare for a long time, I've probably got 65 patients that are physicians, and I know a lot of people through the internet as far as like program directors and stuff. So I should be able to get some pretty good elective rotations and some sub-Is and things like that, hopefully. The main thing that's helped me to land on Dean's List every semester that I've been in so far. I can't say that like my knowledge in chiropractic and having worked in healthcare for a long time. I worked in a family medicine practice for almost 2 years. I worked in a sports med outpatient in a hospital for over a year. And then I've worked in an MMA facility. for the last 10 years or so. So I'm not really around medical professionals as much, but we're right next to a hospital. So we've had PMR residents come over from Loveless Healthcare and spend some time with us. Um, we really try to communicate interdisciplinary a lot. But yeah, I think my education previously obviously gives me a big advantage. Being a good test taker obviously gives me an advantage, but I figured out the style of studying that works for me, and that's spaced repetition using Anki cards. But it has to be in my language, the way that my brain interprets it. So I have to make them. I've tried using Anki and some of these other ones. It just doesn't work as well for me because it's not. It's like reading something that somebody else wrote. It doesn't flow the way that my brain flows. So when I see a question that I wrote, it helps me to remember that topic. So when I see an exam, I can kind of work my way through it. I also don't do practice questions yet. I'm sure I'll do UWorld and when I'm prepping for step one. But at this point, it's my opinion that memorizing test questions isn't going to get me ahead. I need to really master all the fundamentals ahead of time. You can't just memorize test questions all the way there. And it's too slow in my opinion. Well, at least for me, it's too slow to go through questions like that. Because a question can take 2 minutes to read, and then you got to spend time, lodging your way through it. I know some folks will just just put answers and then read the answers after that, and that works for them. But again, I think a lot of those folks are already good test takers, so I don't think those strategies would necessarily work as well for Caribbean students or Irish students or any other IMGs that are coming from the U.S. that are probably going to international schools, likely because they didn't have great MCAT scores. So that's my advice for whatever that's worth. It's probably not worth a whole lot because everybody's different. But for me so far, what's worked the best is just, using the PowerPoints, the slides, paying attention in class. And then if there's a topic that I'm having a hard time with, there's certain little topics that don't stick all that well, right? Like for me, it's like clotting cascades and stuff like that. It's just these arbitrary numbers that kind of run around. Like for me, I've got to do flashcards, and I've got to make flashcards out of those things to get them to stick to where my brain is familiar with them. If I don't know a topic real well, then I'll jump on YouTube and I'll watch a video. So there's a bunch of great channels out there. One of them I really like is Medicosis Perfectionalis. If you guys have seen that channel, it's pretty good. I subscribe to the premium membership there just so I can kind of get those videos. Dirty Medicine makes really good videos, especially for biochem. I found him to be very helpful for my my shelf exam. And I didn't run the calculations exactly, but I think my neuroscience was in like a 99th percentile, which makes sense. Again, I'm a board certified chiropractic neurologist, so I was scoring 15 points, 16 points better on the quarterly quizzes than anybody else in my class. I was getting 98s, 97s, and the class average was running 57, 60. I probably could have taught that class, to be honest. So for me to get an 87, I was actually hoping to score in the 90s raw on the neuroscience exam, but there was quite a few embryology questions, which isn't my strong suit. Hopefully there's not too much embryology on step one, because that might be, we were talking about, what does the exam look like? Is it going to be bad for you? That could be something that runs me afoul. Oh yeah, he said, somebody had asked me about the scholarship. So at my school, there's a bunch of scholarships you can apply for. So you can look these up at sjsm.org. I think if you score a 515 on the MCAT, you get a full ride scholarship for basic sciences. I think if you score 505, you get like a half tuition discount. And I'm not sure exactly what the other requirements are, but if you're a healthcare professional, you'll get like a semester scholarship. If you get an advanced degree, so I have all of those. I have a master's in exercise science. I have another healthcare degree, so you can pick up scholarship money in all of those. And if you have a 3.6 GPA in your last degree, which obviously I had, there's scholarship money for that as well. I think my cumulative at this point, I had a 4.0 in neighborhood school. My last master's, I think I had like a 3.85 or something like that. So I think my cumulative is like 3.7 maybe previously. So I qualified for all of those as well. And then at our school, if you score in the top 5 of your class in the raw NBME, for the ones that have the NBME exams, you can earn $750 credit towards your tuition for each of those exams. So this last semester, I got all three of them for my class, obviously. So that's $2,250 towards my next semester tuition. And the tuition's only $9,000 in St. Vincent. So you could really, if you do a good job and you stay ahead of it, you can really you can really minimize your student loan debt in becoming a physician. So that's something I'm very grateful for St. James for having these opportunities to perform well and then also be rewarded for it. So that's pretty cool. And also, like, I have to say that I've been able to like get a hold of the deans and the faculty and the folks in Chicago who run the school. Like, the communication's been fairly easy. I never have a hard time getting a hold of them. So the benefits of the school obviously is you can get in 3 times a year. You don't have to wait. For me, they accepted my old basic science credits. For me being an older student, I'm 41 now in my second year of med school. I graduated chiropractic school at 26. So I was pretty young. So I think all my basic sciences I took when I was 19, 20, 21, which has been a long time. And actually, science has changed somewhat since then. Like, in some of these classes, there's like a few new things, like particularly genetics. Like, a lot of genetics has changed in that amount of time. But there's some biochemistry stuff as well where I'm like, wait, I don't remember that. And it's because like there's been scientific advances, quite a bit of it in the last 10, 15 years. I graduated chiropractic school in 2010. So my basic sciences are from, I graduated undergrad in 2006. So I would have to take my, organic chemistry, biochem, gen chem, all those general physics again, if I was going to try to apply to a U.S. school. And I think they moved it to 7 years now is how far it goes back. But for me, that wasn't an option either. I'm not going to go spend 2 years of my life, sitting in undergrad classes or community college or wherever just to take classes that I already got A's in a long time ago. So for me, the speed to get into the program was a very important factor. So that the ability to still utilize my credits from my my previous degrees, and then having 3 rolling cycles a year, those were the big things that made me go towards this. And the reason I started looking at St. James in the first place was the tuition. I do want to do this, but I'm not really willing to put $300,000, $400,000, $500,000 into it because I have a profession, a good paying job that I make a lot of money in, to be honest. So it would have to be something that was affordable to me. A lot of other students don't have that fallback that I do, where they can just go back to their job and make 6 figures, no problem. So they have to go all in. And I understand why some of the students go to schools like, the Big Four or whatever. They do have more graduates. So because they have so many more graduates, they have more connections into certain residency programs. But that comes at a cost, right? You're going to have to pick up $400,000 or $500,000. And so you have to kind of decide, which of those things are more important to you. And for me, it's like I have connections. I can meet people. I'm obviously an outgoing person. I don't need to rely on the school to make me connections necessarily. And so if that's the case, then I don't want to pay the extra amount of money. I want to do this as affordable as possible. And St. James is the school that really stood out to me. And so far I've had nothing but a great experience. I really can't complain about anything. I mean, the things that I could complain about, that's just med school, right? Like, it's just, you're getting your ass kicked. Sometimes they move exams when you don't feel like you don't have the time to study. And then some of the, trials and tribulations of just not being in America. But luckily I've had experience not living in America before. Like, I did my sports med internship in chiropractic school in Colombia. So I lived in Bogota for I think about 5 months before that. So I've lived in other countries before, so that wasn't super foreign to me. And comparatively, both Anguilla and St. Vincent are a lot more Americanized per se than Bogota was. So obviously the language, they both speak English, but like the types of things you can buy in the grocery stores and things of that nature, those islands are a lot more American, which of course makes sense. They're more trading partners with the U.S. than South America, obviously. So those have been some things that I've been dealing with so far. Yeah, so somebody asked how school's going. Yeah, it's good. It's fine. There is definitely some attrition, obviously. Some of the folks that don't belong in school, they don't make it this far. They're not making it to the second year. For better or worse, it is what it is, right? That's just how these Caribbean programs work. Like, because they're a little more lenient and accepting, they're going to have some people that don't pass, and that some of their tuition is part of what's keeping the schools open to give the rest of the people an opportunity. All the schools can do is give you an opportunity, right? They're giving you an opportunity that you didn't have otherwise. So you have to look at yourself in the mirror realistically and say, am I going to be one of these, one of the top 40% of the people in my class, the top quartile, that is going to score well, that is going to pass my step, that is going to make connections. And a lot of people, of course, lie to themselves, but you have to be realistic. Like I said, you can't be scoring 15, 20 points below the national average in NBME and think you're going to pass step. You need to be at least within 5 to 10 points every single time. Or in my case, you want to be, I'm trying to shoot 15 points over every single time. That way I know I'm on track. But these schools, like I said, they give you the opportunity. Like if you want to be a doctor, this is the last chance for a lot of people. And schools like St. James are the schools that really provide you that opportunity. So for that, I'm really grateful. But yeah, we've had some attrition. So now my class is stacked now. There's not a ton of people left in it, like from where we started. My original class, because I had to take an LOA because we had some health issues. But this class had 25 in them. And now I think we're down to 15 or so. So, but the students that are left in the class are really smart. They're studs. So I think just offhand, we have a pharmacist, we have a speech language pathologist, we have a behavioral therapist, we have a critical care nurse practitioner, we have a PA, we have a massage therapist, we have a pathology assistant, and then 2 of the younger students have worked in the hospital, in the ER for a long time. So the folks we have left are really specialized in their knowledge. So, and you can see that in certain classes, like the pharmacist is like really good at biochem. I'm sure she's going to crush pharmacology. The massage therapist was really good at musculoskeletal anatomy. So was I, obviously. For me, it was neuroscience because, like I said, I'm a board certified chiropractic neurologist. The pathology assistant is obviously killing pathology. We have another lady, she has a master's in research and she's worked in like micro labs. So she's really good at like biochem and microbiology. So like the students that we have left are really good. I think, I would guess at least 80% of these folks are going to match. And most of us are kind of going into very niche specialties and all primary care type specialties. So like we have like psychiatry, internal med, family med. That's kind of where a lot of us are aiming. We're being realistic about like where we want to go. For me, I'm looking at the main 3. The main one I'm looking at primarily is O&MM. But I'm also looking at neurology and PMR also. Many chiropractors that go back to med school go into PMR. I know probably 6 or 7 chiropractors that went back to med school and went into PMR. It's a very, clear and straightforward path to do that. It makes a lot of sense. It's something they were already interested in. But a lot of them just wanted to expand their scope and do more things and become physicians. I also know somebody who's a neurologist, which is ironic because neurologists generally don't like chiropractors. But I know at least 2, if not 3, chiropractors that ended up being neurologists later on too. So those are kind of the 3 specialties that I'm looking at the most. If things don't work out and I have to scramble into internal or family med or something like that, that's fine too. I have a lot of interest in medicine, generally speaking, but for now, those are the kind of the 3 specialties that I'm looking at. I have a particular interest in manual therapy, so osteopathy is the thing that really intrigues me the most. But all 3 of those fields are sort of interlinked. So we'll see what happens with rotations. We'll see what happens with sub-Is. We'll see what happens with electives. We'll see what happens with audition rotations and things like that. I was able to do an audition rotation-ish with a program that I really like a lot. So that's, right now they're number 1, obviously. But I guess we'll kind of see how things go after that once I actually get into my clinicals and, if those programs are still have the people there, the same program directors, the same attendings, and their philosophies are still the same. So I don't know. We'll see. There's a lot on the table. I mean, there's no guarantee I'm going to finish the program either. Life comes at us. We never know what's going to happen. But, as of now, that's kind of what I'm aiming for, So yeah, if you guys are watching, drop some questions in the comments. I'll do another live. We'll go over this stuff. If you guys are interested in my school, St. James School of Medicine, sjsm.org, go check them out. I'll link them below as well. I've had a few students that have come through that have, seen my stuff, seen my interview from before. I'm kind of able to point them in the right direction. So that's some of the stuff that I'm answering on this. I know a lot of people are curious about like the path from chiropractic to medicine. I think I talked about that in a previous video. I say too much in these videos. You ever notice that? Neuropathy, we can get into that. Yeah, so drop some questions if you guys have questions about like the islands or the med schools or the specialties, or if you have generalized questions about chiropractic or naturopathic or YouTuber, being a YouTuber. Yeah, I could probably answer a lot of those things. So I'm looking for, topics to get into a little bit. I was thinking about doing some lecture type material, but I'm not sure that this is the format for that. If you guys, maybe my OG, you guys used to watch my lectures. I've taught doctoral students for almost a decade now. So I used to broadcast my, right around the same time Jordan Peterson started, I would broadcast my biomechanics lectures and my sports med lectures back in the day on my Instagram live, and I would put them up here on YouTube as well. I think I put them on a different channel maybe. So that's a format I'm comfortable with. I probably just don't have time to do that right now. Obviously, I have a lot of exams. I think I have 4 exams next week, so I got to kind of, like I said, it takes time. It's just a time thing. It is what it is. It's med school. You got to put in the time. But if you guys have any other ideas for the channel, you have questions, anything, drop them in the comment below, and I'll catch you guys in the next one.